and welcome to Health Digest. I'm excited to be your host today on the edition of the program. I am Ukeme Etuknwa. In case you didn't know, if you know, well, you're welcome once again. Health Digest is that one-stop health program that aims to keep body, soul, and mind all moving in unison. My aim is to optimize your health. It is to decode your health and prescribe the truth. That's right. We bring healing, hope, and definitely a lot of discussions that are happening in the health field. So on the show today, we're going to be discussing with the experts on a number of issues, as well as bringing you your health news. We will be also looking at some facts and ensuring that everything you get is fact-checked. All that in just a little bit. Let me start with your health news.
High consumption of ultra-processed foods like salty snacks, processed meat, and other packaged products are associated with high risk of obesity, hypertension, stroke, cancer, type 2 diabetes, and depression. This national summit by the Nigerian Heart Foundation on the Heart Logo Awareness Campaign is a major initiative to help people identify food products healthy for consumption.
We have a lot of packaged foods on the market. It is not easy to recognize foods that are healthy. So the purpose of this program is to create the awareness of the whole population of Nigerians. When you go to the market, you can, within a minute, spot the red mark logo and say that the food is healthy.
Normally, before any food items on the market, they are usually registered by NAFDAC. So what the Nigerian Heart Foundation then does is to add additional level of check to it.
The Nigerian Heart Foundation Food Labeling Program was established in 2003 in partnership with NAFDAC. The program aligns with global best practices similar to initiatives implemented by heart foundations in other countries. Oshomowa Daniels, AIT News, Lagos.
In June 2024, the federal government introduced an executive order to eliminate tariffs, VAT, and import duties on pharmaceutical raw materials, equipment, and machinery to lower production costs and boost local pharmaceutical manufacturing. The aim was to reduce the cost of medicines and encourage local production. But Alex Ikweche in his motion insists that despite this intervention, the cost of medicines keep rising.
The House notes that according to the Nigerian Association of Pharmacists, the prices of some common medication have increased by 300 to 500% due to factors including inflation, naira devaluation, import dependency, and supply chain disruptions.
The lawmaker noted that the Federal Competition and Consumer Protection Commission in February this year revealed plans to investigate this ugly development, a move he says has yet to yield positive results.
Disturbed that Nigeria still imports over 70% of its medicines and active pharmaceutical ingredients, APIs, making the country vulnerable to international price dictates, shocks, delays, and supply disruption.
The House mandated relevant committees to ensure compliance with these resolutions. Plenary also saw 4 Kano lawmakers moving from the New Nigeria People's Party to the African Democratic Congress, with Amadou Kabirumbe Palace moving from the People's Democratic Party to the All Progressives Congress.
This decision to resign from PDP is principally due to the irreconcilable differences that culminated in the formation of different factions, which eventually eroded the unity and cohesiveness of the party.
The move is in continuation of lawmakers' realignments ahead of the 2027 general election. Ogianave Uduimo, AIT News Abuja.
welcome right back to Health Digest. Yes, as you have seen, there has been a resurgence of COVID in the country. But I'd like to tell you it is not cause for you to panic. The good news is we beat this deadly virus at a particular point a couple of years ago. Yes, I brought that to you on COVID Digest. So you have everything you need, and the Nigerian Center for Disease Control is working very hard to ensure that this disease is actually contained. And as you can see, our lawmakers are currently taking that discussion up to the right places. So there is no need to panic. On the show, I will be giving you tips on how to stay safe, stay sound, and ensure that your friends and family are optimized, because one of the most important things when it comes to COVID is your immune system. So that is the best defense that you can actually have against this. But like I said, it is not even a need for you to panic because it is being contained. But this is Health Digest, and these are some of the discussions we're going to be having. The month of April was World Earth Day, and as an inhabitant of Earth, I hope you are too, I'm sure you are, it is one that we cannot just, put behind us easily. We will be celebrating climate change, which is one of the biggest focus when it comes to taking care of Earth, which happens to be where we currently are. So for World Earth Day, we'll be discussing with an expert. We're going to be discussing with someone who has a big profile when it comes to biodiversity, environmental studies, and he is a professor. That's right, he is a scholar in his field of discipline. We're going to be discussing with Professor Henry on a number of issues concerning climate resilience when it comes to World Earth Day. So we're going to be having him in just a little bit. Here is a little bit more. Well, the 24th of April is World Earth Day, and you are a professional, an expert to be exact, as well as a scholar in the field of environmental science and more. What does World Earth Day mean to you, and what does climate resilience have to do with the Earth? Let me start with those hard questions.
I'd like to do a little bit of a proper introduction. I'm actually Professor Sawyerr. Henry is my first name. Lawali been the middle name. Having said that, the importance of the health to me, and probably to every one of us, is that the earth remains the sole inhabitant where man has existed over an historical period of time. The existence of human beings in the earth is also at the survival of the ecosystem within the sphere within we all exist. When I say the ecosystem, it means that man does not exist in isolation. And so the anthropogenetical activities of mankind has also become one of the major factors, the result of industrialization over the years. Has been a major factor in fossil fuel burning, which has tremendously impacted on the heat wave that we're experiencing recently, vis-a-vis the changes in the climate. So when we talk about the World Health Day, it's more on making sure that what enables the coexistence of human beings within the ecosystem that also help to sustain all other animals and plants must all be given due consideration. So flaunting that is what has really led us to a point now where we're experiencing a serious climate change factor, heat waves, and of course, individually that affect mankind.
Thank you so much for that overview on World Earth Day, and you've hit some of those critical areas. Recently, we have gotten into the flooding season, and year in, year out, we, tend to cry for help when things get very turbulent, and then the next year, when things turn down, we go back to a calmness of a sort, and then the next year it resurfaces. And I personally have gone to a couple of states. I went to Kebbi State at a point during field work, and I happened to be on a bridge that had collapsed due to the flooding, and the erosion was so bad that you had dead bodies floating as well as buildings, and it was just so chaotic. So I'd like to know, when it comes to climate resilience and flooding, what has been your observation, and what do you think the stakeholders need to do to ensure that we have resilience when it comes to climate change?
Thank you very much for that question. And I'll say quite categorically that what you've actually observed has been the same incidences, if nothing at all, probably for over 10 years now in Nigeria. Year in, year out, we're aware that the season of flooding is coming. And when the devastation takes over, we all jump into the sentiment of emphasizing on the devastation. And obviously, the moment that devastating period had gone, and we've paid all kinds of lip services to what is it we're going to do best, both the government and even including the citizens. You know, we often forget that state of despair that we've just gone through. And we'll go back to doing the same thing. I'll give you an example. When you have excess water, there is to an extent how much water the soil can absorb, because before it becomes unretainable. And when it becomes unretainable, I'm talking in terms of the soil now, it tends to leak the water off in the runoff. And in most cases, there are also, to certain level, how far this water can recede or expand. We call those locations wetlands. Mm-hmm. And having come through the experience of one flood season, I would have expected that the government would place that strong emphasis on how close people could build to the flood pathways. And if you at least can tell them you can't come this close, it means that you're expecting or anticipating that if any other flood season should come, there's every tendency that the people will despair. Then in most cases, even when those folks are told, they go back there. Go back to rebuild again. So, you ask yourself the question, don't we really learn what we needed to do seriously in this country? I personally, I'm not the one to blame federal government when you have incidences, or states in most cases. The reason being that the distance and relative effectiveness in handling those issues are not almost as close as what you call the local government. So I personally see that we do have a number of inefficient local government authorities that are probably not quite well educated to understand the consequence of why they serve the people within their constituency, and that their responsibilities are not just simply administrative, but again in handling this new menace that is confronting us every time. And the people, I think we need to get some level of education and awareness in understanding that we're in a new era. We're in a new era. And so we need to have a new thinking. That's my take.
Thank you so much for those insights on that. You did mention some very critical points when it comes to building the particular sites, the land use. These are all quite important. However, I mean, it is a health program and environment is important, but also the inhabitants, having lived in these particular areas, you can imagine why it might be a bit hard getting some closure for them to move, but you have put some very good points across there. Now, when it comes to the issues of the heat waves, what do you think speaking of heat waves, I have seen you have your water breaks quite a couple of times, which definitely is evident of the heat waves we are speaking about. And it seems each year it keeps getting worse and worse. Is there anything that we can do to reduce the effects of climate change and the ozone layers?
As a country, as people, I think to a large extent, we're beginning to make gradual migration. And I think this is still coming much from the federal government initiative. When I say gradual migration, all the emphasis on CNG vehicles, moving more and more towards solar, all these all contribute to reducing our dependency on fossil fuel. We still have a long way to go, without any doubt. But it's not just a consequence of what has happened here in Nigeria or Africa. And I'm sure you must have been following the COP23 and all the various COPs initiatives by the United Nations. It's quite a very tough thing to get through to. But the role that African countries have to be played, the role that Nigeria have to play are all in discussion. And so the nation is moving those policies closely. But if you look at what the federal initiative and the push, if you look at what it's been, I haven't quite seen the same level of seriousness with most of the states, let alone the local government. If you observe, I keep emphasizing on our local governments because the local governments are the ones that are closer to the people. They're the ones that deliverables can actually have a greater effect. We're talking about heat waves, we're talking about climate change. These are new initiatives that we're confronted with as a nation today. But how educated, how enlightened are our people that what used to be is no longer what it is? And this would affect quite a number of range of issues. Farmers, if they're not aware of the new weather pattern, weather season, to be able to adjust the modality of cropping. Even the kids in primary schools are not well educated. There are a lot of our people in rural communities that are not enlightened as to what is that we're facing with now. There is heat wave, there is flooding, there is climate change, all of these, erosion, all interconnected. So we need to do more in enlightening our folks, that our people know about what are the federal policies,
Yes.
state policies. How those things should also become part of our new educational curriculum.
Yes, I think those points you've made are very, very important because knowledge is power, and I mean the good book says that my people suffer because of lack of knowledge. So if they do not have the knowledge on this, it might be a bit hard practicing safer methods. So I must speak about the elephant in the room. Should I call it an elephant yet? I'm not so sure, but you must have heard of the resurgence of the COVID-19 pandemic in Nigeria, in the southern part, particularly Cross River State, and the Senate has made some deliberations and are still trying to discuss the updates. Now, from an environmentalist point of view, what are your insights on this, and what would you say the forecast is for Nigeria? What should we do? Where exactly should our mind be at right now from an environmentalist point of view?
Thank you very much. In fact, I am an environmental health specialist.
Even perfect, please.
Yes, yes. And for instance, the resurgence shouldn't really have been. And what do I mean by that? Just like the same, government policies. We always take our foot off the pedal when we would have actually done something good and we have accomplished a positive record. If you look at what we accomplished during the COVID incidences itself, it's quite an outstanding record. But we left what we should continue to do continuously. Any emerging or re-emerging diseases can always be captured, and in this case, sanitation would have been one issue, or even this particular incident must have also been migratory, because I don't think it's been with us all this, about 5 years now. How did we miss it at the port of entry? How did we miss it at the port of entry? At port of entry, we have those environmental health officers, or we should have continued to retain them after. If you go back to most of the schools and all the exclusive initiatives that were done in hand washing, don't touch the spots, come and do fumigation, those things are all gone. That's what I said again. And that's the simple approach that we do. We should go back intensively.
So you're saying that if I'm sorry to cut you, Professor Sawyerr, but are you trying to say that these practices that we adopted at the time, because I remember even to things like supermarkets and places, you had to wash your hands and have these adhere to the safety guidelines. Are you saying that the fact that we should we say we defeated at the time the pandemic, which was COVID, we should have kept those practices till now rather than doing away from them? Is that what you're saying? Or are you saying that when it comes to the surveillance part from the airport, that they didn't have the right checks and balances for it to have come back in, which should have been a better approach? Or do you say both of them should have been working at utmost level?
Both of them should have been. And can I say this? You'd find it interesting to know that the essence of inspection, fumigation, it has been with us since pre-independence. That's number one. We're talking even about COVID incident because COVID is related to what we call the pandemic at global level. But in this same country that we're in today, Lassa fever is killing more people than COVID. Malaria is taking more lives than COVID. And all these three still revolves around what you call sanitation. Poor sanitation. And then the surveillance you said at the ports of entry. The combination of the two is what we need to trigger immediately. But again, we have this case in what do you say again, Calabar or where? Cross River?
Cross River has the COVID cases.
It means that we need to now do our best to make sure that we can actually circulate it in Calabar. And for most folks, they trigger the same initiative that we did the last time, because that would put us in a better prevent.
All right.
That put us in a better prevent. And also the port of entry now, we need to trigger back that surveillance, check that different port of entry, because in the first place, a case study must be able to relate to how did it get into Calabar? Where is the port of entry?
I think you're asking, we should definitely focus our attention to ask better questions here, like you've just said. How did it get to that point without proper detection? You have made some very good points, and I think our airport authorities will definitely take note. We definitely have seen a little bit more calm when it comes to the safety guidelines ever since what we thought was the end of the pandemic. But I think you've made some very good points that these are things that we should keep in motion regardless, because like you've said, Lassa fever, meningitis, and so much more are killing Nigerians faster than COVID ever did. So right now, what tips would you give to these two major stakeholders, the citizens and the decision makers at this point, the Nigerian Center for Disease Control, the Cross River State Government, and obviously our frequent flyers? What would you say to all of them at the moment? Remember, we do not want to cause panic because, as you've said, we have bigger things to fry, like the other diseases you have mentioned.
I think NCDC has always done a good job of being able to intercept emerging and re-emerging diseases in terms of documentation. They have a very, very effective surveillance system in place because they capture it on what you call a real-time basis. And so, of course, it means that the state government, the local government should, of course, in combination with the federal, and NCDC should all work together. But there's also one other team member that should also be activated into this group, and I think they were the last time. It's the Environmental Health Officers Association. The Environmental Health Council should be brought in also at this stage, because when you talk about fumigation and all the rest of it, when you essentially when you said you are isolating a location, they're also the ones that are trained to be involved. They're the ones that are trained. Then the basic things we all triggered back that last time, we should bring it up immediately so that we can quadrant wherever that location might be in Cross River State and nip it in the bud. We did with Ebola, remember? Even though it was coming in through Lagos, we were able to track it, we were able to nip it in the bud with effective operations of Lagos State government at that point in time. So if we know where this is also in Cross River State, oh yes, we have always been very effective. But we do that in most cases only where we're at a tipping point of danger. But I'm sure once we trigger this group, NCDC, state level Ministry of Health, state level Ministry of Environment, state level Ministry of, the Environmental Health Council, the Immigration Office, etc. Then would get this up in Cross River State, I have no doubt. So obviously that means that we don't need to panic. We don't need to panic because I know us when it comes to fire service, we can trigger and we can get effectively things done. But just as NCDC has its surveillance system in place, I would also take advantage to state to the Federal Ministry of Environment that they also need to have the environmental health surveillance system in place.
All right.
So some of the things that are captured can also come back, through some of the environmental factor meetings.
Thank you so much for staying tuned. You can count on us on Health Digest to keep you safe, keep you sound, and definitely unbundle the medical jargons for your understanding and your safety. I'm Ukeme Etuknwa. It's been such a blessing. Stay blessed and not stressed. Bye-bye.